Welcome back, and we are talking to plastic surgeon Derek Antel about the latest techniques in liposuction. And now we're going to do a little show and tell and see what happens when you have this kind of liposuction. So, doctor, why don't you take a look at the pictures here?
Carol, this patient is, in my opinion, an ideal candidate for liposuction. She's basically in good shape, as you can see in the before. But she had an area roughly from her belly button on down that she just couldn't lose, no matter how many sit-ups she did. So we performed a liposuction procedure on her to remove that excess fatty tissue.
It's really quite a... You're talking about maybe a 2 or 3 inch difference. And all of that is just fat buildup. It really is just the way fat is deposited in your body.
That's correct.
Not necessarily how fit you are or whether you're at the correct weight.
Exactly. Many of the patients that I see work out regularly.
We want to also call another one up here, and that's the chin liposuction. So let's take a look at that.
Oh, yes. This lady,
quite dramatic.
Thank you. This lady had liposuction in that area to remove the excess fatty tissue, and it allows the skin to retract. Now, in a younger person, the skin's more elastic. You'll get more retraction. Sometimes we may do a neck lift as part of the procedure as well.
Now, this is the direct result of the surgery. We're not talking about somebody losing a couple of pounds in here in the before or after.
She did not lose weight in between.
That's really a direct result of the surgery. It's really quite amazing.
Thank you.
We have a caller. Denise is calling us from Boardman, Ohio. Hi, Denise.
Hi there. My name is Denise. I'm 26 years old, and I was considering getting, it's called abdominoplasty, that's liposuction from the stomach and on my thighs. But I wanted to know, what is the infection rate, and does the rate depend on where you get it done?
Good question.
Abdominoplasty is actually removing excess skin as well as removing fat. We need to clarify that a little bit. If it's just removing excess fat, which would be liposuction, the infection rate is very, very low. It's less than 1%. Sometimes there may be just a little bit at the wound entry point. Abdominoplasty has a slightly higher complication rate, so you'd want to clarify that with your surgeon beforehand.
Now, what about the rate of infection where this is concerned? I mean, I would imagine that is a concern for a number of people.
Yeah, as far as the wear, obviously it has to be done under sterile conditions. And I think you need to talk to your particular physician about his facility or where he plans on doing it and what the infection rate is like there in particular.
Can we just talk a little bit very briefly about the ultrasonic liposuction?
Sure. Ultrasonic liposuction is a newer technique that was done in Europe for about 10 years already. It's a similar cannula or similar metal tube to what we've been using all along, but a sound wave goes through the tube and it vibrates at a very high speed. And what that does is it disrupts the fat cell, and then the fat is actually vacuumed out. So
it's just easier to kind of get it out.
So it doesn't eliminate the traditional technique.
Just makes it easier.
It makes it easier on the surgeon, actually.
Dr. Antel, thank you so much for joining us.